And as someone who has survived PND herself, would you care to share your story with us?
Well, I had postnatal depression with my first child and again with my second child. With my third child, I actually remained on medication throughout my pregnancy and afterwards, so I was spared postnatal depression then. But you know, with my first child, I was very low. I couldn't sleep, and that was actually for me the big tip-off. He was a very difficult, colicky baby. I love him to bits, but I mean, he gave me hell in those first couple of months. But when he finally started sleeping, I couldn't sleep at all. And that was sort of a big warning sign to me that I needed to go and see somebody. And the thing is, very often women don't seek treatment because you feel that you're a bad mother or that there's something wrong with you. You feel guilty. But if you seek treatment, you can get better. And usually most women get better very quickly. Within the space of between 2 weeks and a month, most women are back to their normal selves, enjoying their family, enjoying their baby. So really, I would urge all women out there, if you're worried about something, if you think you may have PND, please go and get treatment.
And what sort of treatments are available out there?
You know, there's many different types of treatment. The two commonest forms that we look at are drug treatment, so the use of an antidepressant medication, and then psychotherapy or talking therapies. And the ideal would actually be for women to have both, to see a therapist as well as to see somebody who can prescribe medication. Sometimes if the depression is mild or the anxiety is mild, we use psychotherapy alone. But for many women who have a moderate to severe depression, psychotherapy alone is not sufficient, so we need to use medication. Also, for many women in this country, they can't afford to come weekly for therapy, or they have transport issues, or there just isn't a psychologist available for them. So in those cases, we then have to use medication.
And how safe is it to be on medication, especially if you're breastfeeding?
And I'm really glad you brought that up because so many women don't want to use medication because of safety concerns. The reality is that most medications that we use are very safe during pregnancy and breastfeeding. I took medication during my pregnancy. I also breastfed on medication. And the thing is, look, no medication is 100% safe. Even things like Panado is not 100% safe, but you've got to weigh up the risk to the baby and the mother of an untreated depression and the risk to the baby and the mother of medication. And the fact is if a mother has a diagnosable depression or anxiety disorder, there is really very minimal risk to the baby if we treat with medication, but there's a big risk to the baby if we don't treat that mother. And there's also a big risk to the mother in terms of continual suffering and also risk to her health and in fact risk to her life.